Next question I get asked, today we're talking about the most common questions I get as a urologist, besides penile girth enhancement and erectile dysfunction. The next most common question I get is, what's the best procedure for BPH, for obstructive voiding symptoms? Remember, I'm Dr. Frank Simoncini, the FloFxr, Southeast Valley Urology, www.southeastvalleyurology.com. If you haven't subscribed to our channel, subscribe to our channel, smash the like button, send this video to your friends that may need it. Helps us with the algorithm, helps us get our message out there. So for BPH, here's the whole thing. Medications help some people they don't. The problem with medications is you're going to be on them forever. They do help somewhat. They have side effects and you're going to be on them forever. That's the biggest downside. For something permanent, what's the gold standard is called a transurethral resection of the prostate. Transurethral resection of the prostate, we go in and we actually cut the tissue out that's blocking the opening between the bladder and the urethra. And this works very well. It's a gold standard. It's been the gold standard 40, 50 years. Okay, however, it's the most invasive by far. Since I've been in practice, at least the last 30, 35 years, even when I was in residency, so let's say 35 years, all these companies are trying to come out with different products that create the same effect as a transurethral resection, which is the gold standard, but is significantly less invasive. And in my opinion, some of them are okay, but there's a lot of failures. Most of them don't work, and most of them not that they don't work well, and they don't stay on the market for a long time. What I try to do in all aspects of my practice, I want to do what's going to give you the best results with the least side effects. Make sense? Best results, least side effects. Okay, so does a transurethral resection work? Yes, it's excellent. It's the most invasive of everything available. If you want a procedure, there's only one procedure that does not have any sexual side effects and no ejaculatory side effects. That's called a UroLift. A UroLift, where the prostate is blocking, we put in implants. We can do this in the office with anesthesia there. You won't feel anything, but you're in the office and you can go home right afterwards. And we put in these bands that pull the tissue apart, and it creates a channel you can urinate through. Why is that important? Well, you can get back to your normal activity the soonest. You have no ejaculatory side effects, no erectile side effects whatsoever. Some patients are a candidate for that. Most patients are, okay? Some are not. The ones that their prostate is too big to have that done, which means it's over 100 grams. The procedure I find that works the best, there's not too many people that do it. I'm one of the few. It's called a thulium laser prostatectomy. So thulium laser is using laser energy, and it just vaporizes the tissue and opens up the channel. Laser prostatectomy has been around for quite a while. Thulium laser works at a different wavelength. It vaporizes and cauterizes the tissue at the same time. What's nice about that is it works at a different wavelength than the older procedures that are out there. This one causes significantly less side effects, significantly less discomfort, and gives you an excellent result with the least side effects. So if you're not a candidate for a UroLift, a thulium laser prostatectomy is a superb procedure. I perform it at Southeast Valley Urology. There's a ton of procedures out there. There's aquablation, there's Resume, there's a bunch of them. I think the two that work the best, that if you don't want any sexual side effects, again, the only one that's really going to work well, I'm a center of excellence for this, it's called a UroLift, or a thulium laser prostatectomy if your prostate is too big. That's going to give you the most bang for your buck, the best results with the least side effects. You heard it first from the FloFxr, Dr. Frank Simoncini. Come and see me in Gilbert, Arizona.